Hello there, I'm Kevin Williamson. I'm the Head of Research at Rotherham, Doncaster and Southampton NHS Foundation Trust. My background is as a nutritionist working in early intervention in psychosis services in the community. The presentation that we're going to give now was one that we delivered to the Nursing Times as part of their awards, and we were actually winners in 2019.
Hello, my name is Helen Oldknow. I'm a learning disability and mental health nurse. I spent most of my career in mental health, working in community and inpatient settings. However, the latter part of my career, the last 5 years, has been spent in research.
So this is our presentation about embedding research into a UK mental health NHS trust. So on this first slide, this shows some of the examples of the infrastructure that we've built. You can see this is our community research hub. So this is a community clinical research facility, and you can see on here a before and after picture. And in the middle of this picture, you might recognise Wendy Mitchell, a Sunday Times bestseller, for her own personal journey through dementia. And she firmly believes, she's a research champion, and she firmly believes that if you look after the most vulnerable in our community, particularly when you're designing research and the research environment, then you can't really go far wrong with things. So in this clinic room, you can see there that she helped us design some of the layout and some of the colour schemes and a lot of the things to try and make sure that we were inclusive of those that might use it. You can see one of the photos on the left there. We've got it kitted out for proper clinical tests and procedures. This community research hub then was opened officially on the 8th of February 2019, and you may recognise there Professor Chris Whitty, who's now the Chief Medical Officer. You probably know him more through the COVID-19, but he opened that just over a year ago for us. This is really important for us because we believe that sort of reaching out to the community is something that we're very keen to do.
So we were aware that our trust is very large geographically, and really to open this facility where people from all areas could access it. And whilst we're in the north of England and we're fairly separate from big cities, and lots of people had a long distance if they wanted to take part in interventional studies, so this gave them an opportunity. So really a lot of this was about equity.
And with that in mind, in terms of our performance and about recruitment, we started off in 2012 as a research team, the grounded research team, with 49 recruits to the NIHR portfolio. And those recruits all came from medical consultants. There weren't any from sort of nurse recruiters or allied health professionals or any of the other professional groups. And in that time, we've grown quite significantly, and research is now part of our nursing and AHP strategy. And the majority of our principal investigators are non-medical. We've grown so much so that in 2019 we had the largest interventional study in mental health, which was the StratCare trial. That was one that we developed, a member of staff in our team developed, and we co-recruited to. We also had 1,912 recruits overall to NIHR portfolio studies. So that's an achievement that we're very proud of. Another thing that we've managed to do is we've managed to build our own, we're looking at developing our own portfolio studies, and we've recently opened a clinical trial into investigational medicinal products. So these are examples of some of our research champions, and we've talked about staff up to now, but we're very keen to develop collaborations with our mental health service users and carers. We're very proud of the diverse range of carers that we've got. I think we've got one of the first young people under 18 as a PRA, and we've had quite a range from different backgrounds. Different things that we've done. We've engaged them in a lot of different projects. They've helped us sort of host events. They've helped us develop the community research hub that we mentioned. They've been very integral to our research conferences. But more importantly, they do give us a check and balance on the different studies that we want to open and how those studies are opened. They help us conduct our feasibility, really. They help keep us on track.
Yeah, they've been involved in the research that we've developed for our own account as collaborators, and written lay reviews, and yes, genuinely helped us as equals, really.
Absolutely. So I think that kind of summarises the involvement of professionals and and our kind of research champions. But all of that together is really important, because that's us trying to build a research culture, and I think it's evidence that we have. We're now aware that research is part of the CQC, the Care Quality Commission's well-led domain, but we're very proud of the fact that research is now something that the Trust has taken seriously and is well supported.
In the latest CQC report on the Trust, our research team and the work that we've been doing with our colleagues and them to support us, got an example of best practice within the Trust. So building a research culture, this slide shows that the work we're doing within the communities and within our own community as a Trust. We're a diverse Trust. We were a mental health and learning disability specialist Trust. However, some years ago now, we as part of the Transforming Community Services Initiative and our Healthcare Trust, and we do work with district nurses, stroke rehabilitation, Parkinson's, issue of school nursing and children's services. So the breadth of the research and the breadth of the studies that we can take part in has really grown. We involve and are involved in lots of different areas within the Trust, and this slide shows some of them. So there was some work on the top right with dementia, and our colleagues and supporters from the Alzheimer's Society. On the top left
was a piece of nutritional work that we did in one of the community cafes in Doncaster, looking at diet and cancer prevention.
On the bottom left, this is a social enterprise within our own Trust, and this helps people to get employment or more vocational works from their mental health issues. Bottom right is work that we've done with people in the community that's supported research, recruitment, and advice on different studies that they think are important to them for us to develop and take forward. This is a picture of our colleagues rather than working in the community. So these are the different studies that we've been working on. So examples of have been recruitment that we've done to the genetic studies on Alzheimer's and Lewy bodies dementia, and the middle one is joint dementia research kiosk that's been out to all our areas and localities for people to take part and register their interest. I think this adds to the work that we've done really on building capacity. We're out there with our colleagues. We're seen and be seen and support them not only in research, but any service improvement ideas they've got, we offer support.
I think it's easy to just think of performance, but actually it's about the outreach, it's about engaging with the community, engaging with the staff and the wider community.
Yeah. We've more recently developed ourselves as a student hub, so we now have student nurses, and we're hoping very shortly to be taking on AHP students to be part of their training really, and to show them that this is really an area that mental health nurses can go into and develop the skills and be researchers in the future.
Thank you very much for listening to our presentation.